medical school has multiple missions. Missions of education, missions of discovering new knowledge, research, and missions of providing service to patients, not only just here in Ann Arbor, but across the world. Google Fiber would have the potential for tremendous impact in all three areas. Our lectures, our slides, all of the presentations up on the web, make them readily available globally. A limitation is the bandwidth. If we had something like this, it would allow us to really take full advantage of the technology that's available in the classroom, but make it available across the world. Right now we're partnering with universities in Ghana, with universities in China, looking to develop relationships with universities in other parts of the world where we can work with them to provide aspects of the content that they don't have the expertise to provide at this time. Fiber, such as being talked about here with Google, really is a glimpse into that future of education, not just for Ann Arbor, but for the world. Not only do we work with them, but they can also teach us. So diseases that when I was in medical school, I was told don't even bother learning about unless you go to Egypt, unless you go to Brazil, etc. They now are here. And so they come in the form of the West Nile virus, so through vectors, but also patients, all of us who travel, are potentially exposed. And so we have to think truly of providing a global-based education. As research has moved from the tradition of essentially a single investigator, a single lab, to being much more team-based, it really means that communication, sharing of information becomes ever more important. We are in the process of establishing what are known as collaboratories. We have some examples of this. For one example, it's what we call the BREM Coalition, and this is a group of diabetologists who are looking to cure type 1 diabetes. Unlike the traditional model, these are investigators who are linked by technology on an ongoing basis, who currently reside in Florida, in California, New York, Chicago, and points in between. That type of a collaboration is made possible through technology. As technology improves, we will be able to link investigators, but also link investigators potentially with their subject, but also link investigators potentially with individuals who are participating in the experiments, especially if they're in a clinical realm. One of the areas that I have great interest in is how do we improve the delivery of health care to patients, specifically with chronic disease. We know, for example, that people with asthma are oftentimes impacted by bronchoconstriction before they know that they're having an asthmatic attack. And so they're not feeling as energetic, they're not able to study as well, they're not able to work as well, they're not able to concentrate and interact with others as well. But with a simple spirometer, just blowing in a little machine, you can tell exactly where their pulmonary function is. The potential to monitor literally thousands of asthmatics at a central area and provide them literally daily advice is all there. We have yet to take advantage of that potential within the U.S. Something like Google Fiber would allow us to run the experiment potentially within the whole community to see, is this indeed feasible? Is it scalable? Is the potential that little proof of concept experiments have shown true when it's taken to a whole community? I'm a general internist, and I have a wonderful group of patients. Too frequently, the patients that really need to see me can't get in because my schedule's full. The people that I'm seeing oftentimes are stable and really don't need to see me that day. With technology, the potential is there to communicate with the people that are stable, assure them that they're doing well, freeing up time to actually see the people who are becoming ill and really need an intervention in a timely fashion. The potential to decrease emergency room visits, hospitalizations is great, but we need to study that to find out if indeed that potential is actually realized when you take it out into the community as a whole. Many wonderful education programs exist, and they exist using current technology, but they could really be augmented with increased bandwidth. Things as basic as a new mother in the middle of the night having access to really sophisticated resources when her infant is irritable and she's really wondering what's going on with the baby. To individuals who are pondering what's the best approach to this cancer I have, and being able to hear the experiences of other patients who have had one approach versus another approach, or learn about in the comfort of their own home when they can really focus. What was it again that the physician and the whole team talked with me about? Because too frequently people don't remember that. They're overwhelmed with the stimuli. We can give them in a very robust way the tools to learn, to understand about what they are facing, about what they are experiencing. I think it would be a tremendous positive. And right now, people rely on Google to find information for a whole multitude of different issues. This would allow that information to be even more helpful, more robust. The whole ability to link physicians, link even patients, link students or learners of all ages, literally globally, is a tremendous, tremendous potential. For example, our medical students, our residents, the most powerful learning experience is from the patient. And so with technology, we have the potential now to take the brain of the teacher with the student without worrying about geography or time. That potential is there. And so if the best place to learn about a particular patient is in Marquette, the student could go there. But virtually then take the instructor's perspective, that mentor relationship with her or him, to the Marquette experience, or the Shanghai experience, or wherever it might be. It really has the potential to revolutionize our whole idea around education. And it's not just the medical student, because the world of medicine is changing dramatically. The biggest need is the continuing professional education of physicians and nurses and respiratory therapists, the whole array of health professionals. So how do we best educate for a lifetime of practice to make certain that that individual understands and maintains his or her competence throughout their professional career? Technology is a tremendous potential answer to that whole conundrum.